All right, doctor, let's go through this. This looks amazing. Let's go through the criteria one by one. So, first is proximal contact is either closed or visibly open. Now, in our course, we teach you to just open it. So, I would say this outline right here needs to be extended a little bit more buckly. Like your whole box needs to be a little bit more buckled. So, you just open it here and open it here. This is not exactly a criteria, but it's just to be on the safe side so they don't say, oh, it's either closed or visibly open. Some of the criteria are kind of vaguish. So I would say if you could move the box over so the center of the contact is more centered to your box. And then that way this will be opened. And you want to be able to open it by 1 millimeter, which is what you have on this side. The side is perfect, but it's a little bit maybe too far lingually here. So just moving the box over. Second criteria, gingival clearance is visibly open. Yes, check, you have that. Outline form may be sharp and irregular. Your outline form is beautiful. So this is what we're looking at for outline form. You are, following a beautiful curve. I love it. It's great that you brought it to that distal groove as well. So it's nice and smooth, and just, maybe this needs to end a little bit more facial and this needs to be a little bit more lingual. So if we could get that, then that's perfection. Outline form is good. Isthmus is between 1 to 2 millimeters. I think you have it. We might get picky and say, it's a little narrow here, but I think you have it. So isthmus is always between 1 to 2 everywhere. I think you have it. That's pretty good. External cable surface margin meets the enamel at 90 degrees. From this angle, it looks pretty good. So we don't want to have a bevel of any kind, right? We want the prep to just kind of come up and then boom, there's the enamel. It ends, they connect at 90 degrees like this. So you don't want to have, if this is the inside of your prep, you don't want to have it being coming like out like this or like this. You just want it to end at 90 degrees to the enamel, which I believe you have. So check on that. And cable surface margin terminates in sound tooth structure. Yes, there's no restorative material. Obviously, these are plastic teeth. Depth of the axial wall extends beyond the DEJ 1.5 millimeters. So these ones are a little bit tricky, and this is where a lot of people under prep on the molars, because in real life, if you did extend it this much, you would probably cause a root canal. But for ADEX, they do want this. So I would say the DEJ of this is around here. That's where I'm guessing. And we want to go 1.5 millimeters past the DEJ on molars. And you're not quite there. So you should probably extend it out to here. So again, always go to max ADEX criteria to start. So measure this for yourself. For anyone who's done dentistry, this is a lot. Okay, this is a big amount of removal to do axially because the pulp horns are right there. But these are plastic teeth, and this is what they want. They want you to go 1.5 past the DEJ axially going this way. So you're under reduced there. So make sure you measure as you're prepping and make sure you get to that 1.5 because you do want to get to those max criteria. Otherwise, they're going to send you back and say you're not at max. So why are you asking for a modification? Retention, we're not using retention. Proximal walls are parallel. Again, I don't have a good angle on this, but I think you have it. So it's this wall and this wall are parallel or slightly convergent. I think you have that. Damage to adjacent teeth, I don't see any right there. That's check. And damage to soft tissue is check. Perfect. So just to recap, make sure you go to your max ADEX limits. Make sure you do get to 1.5. On premolars, it's 1, and on molars is 1.5. So make sure you do extend that, and everything else looks really good. And then just maybe just move your box over a little bit so you get that clearance on the facial. Really great job, doctor. A big star to you. Good job.